Peppermint oil comes from the stem of the Mentha piperita plant and is well known for its healing properties in both traditional and today medication. Applications cover everything from gastrointestinal relief to a topical analgesic. This video explores the science behind its uses, cover top health benefits, potential side effects, and frequently asked questions. But first, a quick reminder. All content is for informational purposes only and should not be construed as medical advice. Always speak to a healthcare professional before introducing changes to your diet or lifestyle, as some health circumstances and drug interactions could be impacted. What do scientific studies say about peppermint oil? There is a lot of research done on the therapeutic properties of peppermint oil. The effectiveness of this particular probiotic in treating irritable bowel syndrome was previously observed in a meta-analysis published in BMC Complementary and Alternative Medicine. Furthermore, an American Journal of Gastroenterology review latter points out peppermint oil can relax gastrointestinal smooth muscles, decreasing spasm and pain associated with functional gastrointestinal disorder. 10 benefits of peppermint oil. Peppermint oil from the Mentha piperita plant has been studied for its many therapeutic uses. It has uses as a remedy for upset stomach to pain relief, which is why it remained an important part of both traditional and modern medicine. Here are 10 evidence-based health benefits of peppermint oil. Alleviates IBS symptoms. The antispasmodic qualities of peppermint oil help the gastrointestinal muscles relax, which reduces bloating and abdominal pain. Another systematic review and meta-analysis, published in BMC Complementary and Alternative Medicine, assessed its influence on patients suffering from IBS, showing statistically significant reduction in abdominal pain and better overall symptoms response than placebo. The ease created with this reduces the spasms and pain due to IBS. In addition, peppermint oil has now been specially coated, so, in an enteric-coated formulation, high amounts of peppermint oil can be delivered straight to the intestines, maximizing its action and limiting unwanted side effects, e.g. heartburn. Eases indigestion. Peppermint oil may also help the flow of bile, a digestive fluid produced by the liver that helps in the digestion of fats. This increased bile flow may result in improved digestion and decreased signs of indigestion. In addition to the above, the relaxant action of peppermint on the muscles of the stomach also leads to its effective healing of dyspepsia. It hampers gastric flow, making digestion less complicated, so symptoms like indigestion-associated discomfort and swelling are also maintained at bay. Relieves tension headaches. Diluted topical application of peppermint oil has been proven to alleviate the intensity of headaches, serving as a natural analgesic effect. In fact, peppermint oil has been proven effective for tension-type headaches in clinical studies. The menthol content of peppermint oil is responsible for its analgesic effects, producing a cooling sensation and reducing contractions in the head and neck. Not just relieving pain, this mechanism also increases blood flow in the area and relaxes it to reduce more headache. Reduces nausea. Peppermint oil via aromatherapy may also reduce nausea, especially the nausea after surgery, but the evidence is conflicting. There have been clinical studies on the effects of peppermint oil for the treatment of nausea, especially post-operatively. In a study published in the Journal of Peri-Anesthesia Nursing, the effects of peppermint aromatherapy on post-operative nausea and vomiting, PONV, were investigated. Patients who inhaled peppermint oil showed a considerable reduction in nausea severity as compared to patients who did not receive the aromatherapy therapy. But not all studies have found the same thing, so keep that in mind. In fact, research has indicated that peppermint oil may be effective in providing relief for particular patients, yet response to peppermint oil can be affected by route of administration and patient variability. Thus, whilst peppermint oil is a promising adjunctive agent for the management of nausea, It should not replace treatment as usually required and practiced by healthcare professionals. Provides respiratory relief. One of the major component of peppermint oil, it acts as a decongestant that soothes the respiratory infections like cold, sinusitis. Menthol achieves this by relaxing and opening up the air passages, as well as by acting as a natural expectorant that can break powder mucus and phlegm to facilitate elimination. Inhaling peppermint oil vapor can relieve nasal congestion in no time. When respiratory issues arise, opening the nasal passages is an absolute must. Adding a few drops of peppermint oil to hot water and inhaling the steam will help clear nasal passages. This technique can help especially during the cold and flu seasons. It is not a synthetic decongestant that you buy at the chemist. Combats bacterial infections. It has also been established that peppermint oil has antimicrobial features, and they report that peppermint oil is effective against some bacterial pathogens. Due to this characteristic, peppermint oil is found effective against multiple bacteria strains. According to a Journal of Microbiology research study, peppermint oil was the most potent in inhibiting pathogenic bacteria, including Escherichia coli, Staphylococcus aureus, and Salmonella typhimurium. Supports oral health. Its antimicrobial effects promote fresher breath and may help prevent oral pathogens. Due to its antibacterial nature, peppermint oil is commonly used in oral hygiene products. Thus, peppermint oil can be added to toothpaste and mouthwash formulations to give them a minty flavor and improve their antimicrobial properties and general oral health benefits. In addition to its antibacterial properties, peppermint oil also shows anti-inflammatory properties, making it helpful at soothing inflamed gums you may have due to gingivitis. This is especially true of peppermint oil, as regular use of peppermint oil-infused oral care products can help maintain gum health and even reduce plaque deposits for better overall dental well-being. Promotes hair growth. Peppermint oil's menthol component has vasodilatory effects, increasing blood flow to hair follicles by widening blood vessels. Proper nourishment blood flow includes the flow of blood vessels that ensures effective delivery of oxygen and nutrients to the tissues, and along with that, hair follicles. Although these results are promising, more research, especially in human subjects, is needed to understand the efficacy and best usage of peppermint oil for hair growth. What are the side effects of peppermint oil? Peppermint oil is considered safe overall, but it may cause side effects like any other product in some individuals. Common side effects include heartburn, nausea, stomach pain, and dry mouth. It can cause skin irritation or allergic reactions if applied topically. Be sure to dilute peppermint oil before applying it. Consult a healthcare professional before taking peppermint oil internally, particularly for people with gastroesophageal reflux disease or a person on certain medications. Frequently asked questions. The usage of peppermint oil can be safe and effective if you understand its practical applications and the precautions that should be taken. What is peppermint oil used for? Peppermint oil is often used to treat IBS symptoms, indigestion, tension headaches, muscle pain, respiratory infections, and as an antimicrobial agent. How long does the smell of peppermint oil last? Peppermint oil has a scent that can remain for hours depending on the strength and where it's put. Ventilation can allow the smell to dissipate more quickly. Can you apply peppermint oil directly to the skin? Undiluted peppermint oil should not be applied directly to the skin as it may cause skin irritation. It should be mixed with a carrier oil like coconut or jojoba oil before topical application. Where can you put peppermint oil on your body? Diluted peppermint oil can be rubbed on the temples and forehead to relieve headache, on chest to support respiratory system, or on muscles or joints to relieve pain. Ensure some irritating does not happen by running a patch test first. Although its helpful properties are numerous and well documented, peppermint oil has several scientifically backed health benefits. But you must use it responsibly and under the guidance of your healthcare professionals if needed. If you like this video, then please do like video, subscribe to our channel, press the bell icon to receive the latest notifications, and do write in the comments below.